I'd like to welcome everyone to the Vasculitis Foundation webinar today. I'm Kathy Olevsky, the host for the Vasculitis Foundation educational webinar series, and I'm also a patient living with MPA vasculitis. Today's webinar is an overview of Actemra with Dr. Jason Springer. These webinars are part of the Vasculitis Foundation's commitment to patient education. But before we get started today, I would like to introduce our guest. Dr. Jason Springer is an associate professor of medicine in the Department of Immunology and Rheumatology at Vanderbilt University Medical Center and is the co-director of the Vanderbilt Vasculitis Clinic. So welcome, Dr. Springer. We're so happy to have you here with us today.
Yeah, it's a pleasure to be here. Thank you for the invitation.
And if you want to just go ahead and share your screen, and I also don't know if you have in your presentation, if you have any disclosures, we'd like to hear that today.
Oh, yes. Yeah, I've got those in there. Give me one sec here. Okay, so things to know about tocilizumab. And these are my disclosures, none of which are relevant to this lecture. And before we get started, it's important to remember that while different forms of vasculitis may share similar symptoms and treatment recommendations, each disease is distinct and each person with vasculitis is unique. So remember that what works for one individual may not work for you. And developing a treatment plan that is right for you requires a careful discussion between you and your healthcare provider, guidance from research studies and treatment guidelines, and the clinical knowledge, experience, and expertise of members of your treatment team. So tocilizumab is also known as Actemra. Actemra is the brand name. Tocilizumab is the generic name. And I'm going to be referring it to as tocilizumab, but same thing. And what it targets is something called interleukin-6. And interleukin-6 is important in terms of driving inflammation in forms of vasculitis. And so here on the right here is a diagram that this is a representation of the cell wall. And that's what the brown line is. And this is on top, outside the cell, and on the bottom, inside the cell. And so what you see here is in green, this is the interleukin receptor. And so interleukin-6 will bind to this interleukin-6 receptor, and then this drives a signal inside the cell that then drives inflammation. And so what tocilizumab does is it has kind of a Y-shaped structure. This is what immunoglobulins look like. And it will bind to the interleukin-6 receptor, and it prevents interleukin-6 from then binding to the receptor. And so you can see there's no signal that gets transferred to drive that inflammation. So here, this shows the pathogenesis of some of the large vessel forms of vasculitis, like Giant's arteritis and Takayasu's, which will be some forms of vasculitis we'll be talking about with this drug. So on the left shows an artery, and within this artery, it's structurally intact, and there's some cells here that are interacting, and then this drives some pathways, and this leads to a bunch of events that eventually leads to changes within the cell wall, including narrowing of the lumen where the blood flow goes through. And so interleukin-6, if you look on the bottom here, this is part of one of these pathways that drives this inflammation in these forms of large vessel vasculitis, Giant's arteritis, and Takayasu's. And so let's first focus on some studies with tocilizumab with Giant's arteritis. So one of these studies that came out was called the GiACTA Study, and this was published in 2017. And this study had 4 groups that they compared. So they had 2 groups that were placebo, or what were the standard of care. So one got a longer prednisone taper of 52 weeks, and another placebo group got a shorter prednisone taper of 26 weeks. And then they had 2 groups that got tocilizumab with that shorter prednisone taper. Now, one group got a weekly tocilizumab injections, and the other group got every other week injections. And they followed these patients over a year-long time period. And what they wanted to see is, was there a difference in some of the outcomes like relapse? And so when they compared these groups, that's what's shown here. Now, just to orient you, on this figure, the y-axis, which is the vertical axis, represents the percentage of patients without flares. So a higher number is better. And then on the x-axis, or the horizontal axis, this is time, so going over a 52-week time period. And so the green and purple lines are the tocilizumab groups. And you can see that those 2 groups did better in terms of fewer flares throughout this time period. Now, they followed these patients for a period of 3 years. Now, the study itself went for 1 year, and that's when everyone was on this study protocol. And what you first see is that those groups with tocilizumab, they tended to have better outcomes right around 4 to 8 weeks, right in that time period. And then by the end of that year, there were significant differences between the treatment groups and the placebo groups. And then after that year, then it was up to the discretion of the treating physician what to do with that medicine. So many of the patients that were in the tocilizumab groups were taken off. And you can see there were a huge number of relapses during that time period. And actually, it kind of approaches the relapse rate that you see in the placebo group. And then over the third year, it remains stable. And so we get the question a lot of how long do we need to continue tocilizumab in giant cell arteritis? And based on this data, I think we should be continuing it for at least 2 years. But after that time period, it's really a judgment call on how long to continue it. There are certain instances where I may be very hesitant to take it off, such as patients that have had vision loss from the giant cell arteritis. Now, they've also looked at intravenous tocilizumab, and this is a smaller study. Again, to orient you, the y-axis, which is a vertical axis, is basically being free of relapses. So higher is better. And then the x-axis is over time. And so the red line is the tocilizumab group, and they have fewer relapses over this time period. So either the injection or the infusions are reasonable options for treatment. Now, in 2021, the ACR and VF guidelines for the management of giant cell arteritis came out, and they did recommend tocilizumab as a first-line option for giant cell arteritis. And this also has been FDA approved for the treatment of giant cell arteritis as well. Now let's shift gears to Takayasu's arteritis and what are the studies behind this? Well, we have smaller studies with Takayasu's. This is a study, again, comparing tocilizumab to placebo, which would be like just steroids, like in the other study. These figures are very similar in terms of they're looking at the percent number of patients that are free of relapse over a time period, which is about a year. And the red line is a tocilizumab group. And they looked at this in two ways, either those that stuck with the protocol or in one, they excluded those that deviated from the protocol. And both ways they looked at this, there seemed to be a benefit from tocilizumab in these patients. This was another study that they compared tocilizumab to non-biologic agents. So these are some of the older medicines like methotrexate or azathioprine or mycophenolate. They looked at this retrospectively. So retrospectively means that you look at how people did in the past, so you're looking at kind of medical records. Whereas prospective, like the study that I showed you last, actually follows people forward in time. So anyway, in this study, when they compared the two groups, this left figure shows the cumulative incidence of relapse. So a higher number is worse. And there were more relapses over time with the DMARD therapy. So these older medicines compared to the tocilizumab. And then when we looked at vascular event-free survival, tocilizumab did better. Here, a higher value is better. So the ACR-VF guidelines do include tocilizumab as a treatment option for Takayasu's, but it's more listed as a kind of a second-line option. And the reason is because, these studies are smaller studies than we saw with giant cell arteritis. And, it is not FDA approved as of yet for the treatment of Takayasu's. And so some specifics about tocilizumab. So you can either do it by injection or intravenously. By injection, most commonly this is weekly because that's the group that did the best in the GiACTA study. But sometimes you can use it every other week. In fact, that's the dosing that we use in rheumatoid arthritis. Now, the intravenous dosing is monthly infusions. The onset of action is typically somewhere around 4 to 6 weeks. And then to give you an idea about tocilizumab, this is not a new drug. It's been around for a while. It was first FDA approved for rheumatoid arthritis in 2008. Then in 2011, it was approved for systemic and polyarticular juvenile inflammatory arthritis. In 2017 is when it was actually approved for giant arteritis. Then in 2021 for systemic sclerosis-associated interstitial lung disease. And then we had COVID, and it was realized that some of these patients that were hospitalized with COVID benefited from tocilizumab. And so in 2022, it was FDA approved for that indication. And so it is approved for multiple different diseases. And so we have a decent amount of experience with this drug. What are some of the possible side effects of this drug? Well, it is an immunosuppressive, so it does increase the risk of infections. Sometimes we do advise people that if you do get an infection while you're on this drug, to hold this drug until you recover from that infection. But of course, talk with your healthcare provider. Hypersensitivity reactions can occur, which are, like allergic type reactions, sometimes can be severe. You can get injection site reactions when you do the injections, and typically these are mild when they occur, so it can be like an irritation of the skin or swelling, and that can get better with Tylenol, Benadryl, or ice. Sometimes when you're getting the infusions, you can get infusion reactions, things like sweating, feeling like your heart's racing, and this can actually improve sometimes if you just slow down the infusion. Now, it can affect the white blood cell count, so you do need to follow that, and the platelets and the liver enzymes. So there is some lab monitoring that you should do while you're on this medication. Also, it can raise your cholesterol values, so that's important to keep in mind, and maybe make sure that your primary care knows that if you're on this medication. Now, there have been rare reports of bowel perforation and with this medicine, and it appears that the people that are at highest risk for this complication are people with a history of diverticulitis or inflammatory bowel disease. And so you need to be careful when that history is present. Now, it is a medicine that suppresses your immune system, and your immune system is actually a surveillance against cancers. And so, it can increase the risk of certain cancers as well. So who should use caution when using this medication? Well, as I mentioned earlier, if you have a history of diverticulitis, bowel perforation, or inflammatory bowel disease, you want to be careful with this medicine. And I tend to avoid it in people that have this history. If you have a history of hypersensitivity to tocilizumab in the past, if you have a history of multiple severe infections, or high and difficult to control cholesterol, or a recent malignancy. Now, these are not all absolute contraindications, but it is something, these are things you have to keep in mind when you're weighing the risk and benefits of this medication. Now, what have we learned from using this drug? Well, tocilizumab, as I mentioned, affects IL-6. And so IL-6 will actually affect how reliable your inflammatory markers are in the blood. So, sed rate and CRP are very commonly used. And unfortunately, it makes these not very reliable at following the disease. Unfortunately, we do need better biomarkers, and especially when treating with tocilizumab. Now, I also wanted to mention that in the GiACTA study that I mentioned earlier that led to the FDA approval for giant arteritis, in that study, they actually excluded patients that had diverticulitis, inflammatory bowel disease, and symptomatic GI conditions, and they did not see any reports of bowel rupture. And so if you want to learn more about tocilizumab, you can go to the Vasculitis Foundation site and look at their treatment page. Also, Medline Plus has information. If you want to learn more about trials that are going on in regards to this or other medications, clinicaltrials.gov. And the American College of Rheumatology, on their website, there is a section for patients, and it does have information on some of the commonly used drugs for autoimmune diseases, including tocilizumab. All right, thank you.
Okay, that was great. I have to say, I have no questions for you. I learned everything I wanted to learn. Thank you so much. I was curious about side effects and things like that, so I appreciate all that information. That was great. I just want to say before we finish up today, I want to share a little information with the viewers also about the Vasculitis Foundation website, because there's a good bit more information on there that might help some folks. Let's see if I can get this up here. There we go. And so what I wanted to say before we finish up is just that I wanted to remind all of our viewers to visit the Vasculitis Foundation website, where you can find all kinds of help and information about vasculitis and treatments for vasculitis. For instance, under education, you can learn more about the various forms of vasculitis. And as a matter of fact, after you've read all about the forms of vasculitis, you can go to the resources tab, and under order or print, you can find short documents that you can print out for family or even take to your primary care doctor's office. And on the VF website, you'll also find a video library with all of these recorded webinars. On the homepage, you will find out more about the patient support groups, which are just invaluable, especially when you're first diagnosed and not sure of everything. You'll learn about upcoming events, for instance, our live webinars that you need to register for, as well as Vasculitis Foundation conferences. So there is a lot to learn on the Vasculitis Foundation website, and we encourage you to visit that. Also, I just wanted to be sure and say thank you to Dr. Jason Springer and to the Vasculitis Foundation for supporting these medical webinars. So thank you, Dr. Springer. We're so happy to have had you with us today.
Thank you. It was a pleasure.